tackling COVID-19, federal government regulations, and the procurement of vaccine is what we're looking at today, being the crux of today's discussion. And with me at my extreme left, I have a senior registrar of public health, University of Benin Teaching Hospital, Dr. Chinyere Unwagogo.
Thank you so much for having me. Good morning.
I think I got that right.
Yes.
Well, we've been on this hill ravaging COVID-19 and it's ravaging the world. And there's this paradox, this contradiction it comes with. Why the virus kills some people with very effective devastation. As we see situations where a lot of persons are seen to be dead, you know. But again, some present or have this illness or have this virus without even knowing it, without being affected. And how do we deal with these differences?
Well, the differences are based on several factors.
Okay.
Factors that have to do with race, factors that have to do with the environment, factors that have to do with the genetic makeup of the person, the individuals involved, factors that have to do with their susceptibility, that's their propensity to easily fall, from infections, or get infected or have symptoms. And we also know that comorbid states, when we say comorbid states, that means the individual already has some form of illnesses before, and so it now makes them more prone to the infection. Now, there are people who don't show any symptoms at all. They don't even know. These are carriers. They're asymptomatic. Okay, they don't have fever, they don't have cough, they're going about their normal activities. And so other people who are susceptible to them, the elderly, although now we now know that there are young people who are now falling ill in this second wave, falling really ill. Okay. Now, so that's those kind of people on that other divide who are susceptible, and then those who are asymptomatic. So that is why the transmission doesn't seem to be winning off, because those who are asymptomatic seem not to care. Okay, they are not observing social distancing, they're not wearing their face masks, no respiratory hygiene, no hand hygiene. Okay, and then they are infecting those who are susceptible. Okay, so that's the.
Actually, it leaves us with a challenge of not knowing who is asymptomatic. There are a lot of persons who are not affected by it, may be having just a common cold and a flu, and not knowing that it could be COVID-19.
Yes.
So how do people, because most times we hear experts saying that those that have underlying problems are really exposed to this. How can one know that he has an underlying ailment?
Well, some people know. Some people know that they do. That's why even before COVID-19, we advise people on regular checkup. Okay, because most of us, because we don't feel sick, feel that there's no need to go to the hospital. We see the hospital as a place where you just go when you are ill. But we've been preaching the fact that you don't need to wait to when you are ill for you to do a basic checkup, like know your numbers, your blood pressure, your blood sugar, cholesterol levels, all those basic tests, because these are silent killers. You could be having hypertension and you would not know until, God forbid, the person has a stroke. So you are saying that it's very, very possible to have an underlying ailment without knowing it? Without knowing. Are you serious? Yes, without knowing. People have high blood pressure and they never know until they have a stroke. And they're not wondering where it came from, but they've been having high blood pressure for a long time. So when such persons are interfaced with the COVID-19, yes, they become more susceptible.
Becomes more susceptible.
More prone to the infection, and their own illnesses are now more complicated. Some people will just have common cold, fever, take drugs, and they're okay. But these people start having respiratory distress syndrome. Their SpO2, that's the oxygen levels are low. They may need to be admitted, giving oxygen and giving more therapy. So that's what's at play. We hear reports, like it's all over the news, that about 75 health workers have been infected in the last 1 week. And one begins to wonder, you are experts, you are the people that keep telling us how to prevent, how to protect, the right kits, the right measures to take. But how come we are having this challenge where 75 health workers are being infected? Does it mean that we have issues with our health sector in that regard? Well, there are issues with the health sector. Lots of issues. The health system is not just about the healthcare workers. It's the healthcare workers, the facilities, the equipment, services at play. When there's a disbalance between all this, then there's a problem. You have the health workers who are there ready to work. Some of them, especially in some health facilities, don't have access to PPEs. That's personal protective equipment, like face mask, hand gloves, and so some of them are exposed All right. Now, in this,
are you talking about in rural areas, as in or in the
urban areas too?
Serious?
Not just rural. Yes, in urban areas too. There are places where there are facilities where they are how will I put it, rationing face mask. Okay, so I come into a place and like I want face mask, and they're like, no, we have already shared it for the day.
Okay.
In some facilities.
Okay.
So imagine that, and then, but you have to work. Okay, but if you say you want to down tools, patients will suffer. You say, okay, I can't work without face mask, I can't work without hand glove. They'll tell you, oh, we've not gotten from supplies, we've not gotten from there. And so the healthcare workers are the front line of this infection because they're the ones in front of it, they're the ones taking in patients, caring for them. Now that's on that the other divide. Now on another divide, you have patients who come in who may not tell you their history. You know, in the first wave, we were all about tell us where you came from. Did you come from the UK, the US, and all that, so that we'll know your history, we'll know what to do. Patients come in, they don't tell you that they traveled. Patients come in, they don't even tell you the symptoms they're having. And so you may be a little careless, or you may not, your mind may not even go to the fact that, oh, this may be a COVID-19 patient, because you know COVID-19 symptoms are similar to malaria and other illnesses. Okay, so you have this patient coming, and you don't even know that they're COVID-19 positive, and so you're catering to them, probably with little or no PPEs or face masks, and so you are more susceptible.
Okay.
So that was causing the increase now in healthcare workers' infection currently.
Okay.
So that's it.
The world has been battling over having the arrival of the vaccines, and just recently, although not really recently, some weeks back, the government did say that we should be expecting it at the end of January. But now, reports have it that they are saying that we should be expecting it from February without having a specific date. Let's look at the vaccines and the potency of these vaccines.
Okay.
What do you think about it?
Oh, well, they are FDA approved. They've been tried and tested, and it's been said that they are potent. Now, but to maintain their potency, there are lots of things that ought to be in play. Okay, I'm sure we heard that federal government is saying we don't have storage facilities and all that. I don't think. Okay, when they say storage facilities, I don't think they mean the buildings, like we don't have warehouses or something, or which we know we do have. Okay, storage facilities has to entails how those vaccines will be kept. Yeah, and they have to be kept refrigerated. Yeah, and you know what we're facing in this country, power supply and all that. Because the minute you have a vaccine that is being stored and not stored at the right temperature, it loses its potency. So we need constant power supply for those things to be stored adequately for them to be potent. So which means we already have a challenge. We have a challenge. So the federal government is not coming out straight to tell you that, oh, this is our challenge. They're just telling you that we don't have storage facilities. Okay. Which we're looking at it, we know that yes, that's true in a way, because storage facilities entails a lot. Entails where these vaccines will be kept, how they'll be transported in their potent state so that they don't lose their potency. Because the minute they lose their potency, then we're already fighting a lost war. Okay, but aside that, we also hear reports that even the vaccine, even if you take it once or you take a second dose, really doesn't stop you from getting the virus. How true is that? Because if after taking the vaccine, and then one can also contact the virus, it then makes no point of even taking the vaccine. So how do you respond to that? Okay, now most vaccines, you know, before COVID-19, we had several vaccines that we give children. Okay, now that those children take the vaccine does not mean that they are not exposed to the various viruses that cause illnesses. But what the vaccine does is that it builds up antibodies in those children, over as an adult, that prevents you from getting sick. Do you understand? From that virus. Getting sick, getting ill, or start showing symptoms. It sort of curtails it. Now that people have taken BCG vaccine is for tuberculosis, doesn't mean that they don't have the bacteria in their system. But the bacteria is not causing any illness because they're already vaccinated against it. They already have antibodies to fight it. Okay. So the vaccine is not like a physical shield that shields you from getting the virus, because you have your nose, you have your mouth, you have your ears. The vaccine will come. I mean, the virus will come in. But you taking the vaccine protects you from getting ill or dying from the infection. Or having a minimal effect of any ailment. Yes, and they should also know that COVID-19 has various strains. Now this vaccine that has been developed against the strain that was quite obvious. Do you understand? The strain that was obvious to the scientists and all that. Well, and it targets a certain protein that the virus is said to use in, I'm just trying to use a layman's word, in spreading and all that. So basically, the vaccine would save will save an individual from, you know, getting ill or getting overtly infected by that virus, but not against all strains.
Okay, thank you.
Several strains currently.
Okay. In case you're just joining us, as TMI Tuesday, and we were talking about tackling COVID-19, federal government interventions in this, and as regards to procurement of the vaccine. And I've been having a chat with Dr. Chinyere Onwawago, and basically she is Senior Registrar Public Health in University of Benin Teaching Hospital. Yeah. Now, before I let you go, let's look at the University of Benin Teaching Hospital, where you work, or where you take care of patients. Now, this aspect of managing the cases at the University of Benin Teaching Hospital, how is the experience like?
Well, the experience has been quite good.
Or do we have any cases?
Of course.
Okay.
It's a tertiary institution. It's also a testing center, so meaning that people come in to get tested, and meaning that people who are ill or need admission into the isolation centers come in there too. Okay, it's been well, I would say a fair experience, because from the first wave we had several domains trying to cater to the health needs of patients, especially with COVID-19. We had a risk communication group, those who talk to people about what's going on, what to do, social distancing, wearing a face mask. Then we have those who are actively involved with surveillance. Okay, surveillance means that these people who you are with don't look symptomatic. Okay. We are testing, we are contact tracing them. Those who may have come in contact with those who are infected. You're contact tracing them to see those who are high risk, so that they can get tested. Then you have those who are involved in the case management, those who are already positive. So that's how we've been going through it, from the first wave to the second wave, trying to communicate to people on what they need to do to prevent the infection, trying to contact trace those who may have been exposed, to see those who will need to get tested, and then managing those who've had complications or who are ill from the illnesses. Okay,
what appeal do you have for the government in terms of beefing up the health sector?
Well, for the health sector, I would think that lots of things need to be done, both in the rural areas, the urban areas, having to do with infrastructures, because I don't want to say very soon we may be overwhelmed with the cases that we're having, meaning that we may need more space. I'm talking about generally in tertiary institutions. So they need to improve the infrastructure. They need to improve the equipment, PPEs, provision of PPEs. I think that's the basic thing they need to do for most healthcare workers. Let them have access to masks, let them have access to hand sanitizers, gloves, and all that will need to protect them against the infection, since they are at the front line. Then services, they will need to improve services, because the health system is all about the services, the infrastructure, and the healthcare workers. Thank you so much, Dr. Chinyere, for taking our time to be part of this show. Thank you. Well, this will we call it a wrap on this segment. We'll also be extending the frontiers on this discussion as it pertains to tackling COVID-19 after this timeout. Stay with me.